Welcome to Fertile Minds. My name is Robert Lahoud. I'm a fertility specialist and reproductive endocrinologist, and I work as the clinical director at IVFAustralia North Shore. Today I'm going to talk about fertility in the 30s. Around the world, patients are now trying to have families later than decades ago, and this phenomenon, I guess it has to do with our lifestyle nowadays. It happens not just in Australia, but it's really common in Europe and other parts of the world, and it does have certain implications on the chances of conception. For example, a woman at the age of 40 with everything we can do, including several IVF cycles, has got a 50-50 chance of having just the one child, and it'd be very difficult to have two. So when people try to decide when they want to conceive, they need to consider that it does get harder, and some people miss out as they get older. Furthermore, you may want more than one child, and each time to fall pregnant, have a child and then be ready to fall pregnant again does take time. So this is something that's important for planning. So as soon as someone's ready to have a child, I guess they should look at trying rather than delaying. That would be always our recommendation as much as possible. And look, it's important for both partners, male and female, or female and female, to understand that this is an important part, and that the biological clock will keep ticking no matter what, sort of thing. With regard to how long does it take to conceive, a woman at 30 will on average take about 6 months to conceive. At 35, it'll be 8 to 9 months, and at 40, it'll be about 12 months. So as people get older, the time to conception increases, and with that comes the rate of miscarriage going up, conditions such as Down syndrome going up, and so it can take a lot longer to achieve a healthy birth of a baby, sort of thing. So from that point of view, it's always important to consider trying to fall pregnant as soon as possible. With regard to looking at ovulation and the timing of the menstrual cycle, this is a really important part to understand when the ideal time is to try to fall pregnant. So generally we would encourage people to keep a calendar to see how long the menstrual cycle is from the beginning of one period to the beginning of the next period. If that's within 5 weeks, it's likely that the person is ovulating. If it's longer than that, there may be a chance that they might not be ovulating, and it would be worthwhile to seek some help from your medical practitioner. When you try to conceive, I've got two principles. One is to try regularly, if that's possible, and to try before ovulation and not to wait till it's too late. Because we can't always predict ovulation easily, I almost think it's best not to kind of make it too scientific, but to try regularly as long as that's possible. If people want to know when the right time is for ovulation, a lot of people use these ovulation kits, which you can buy from your chemist or supermarket or order online, and they use urine tests to see when the hormone called LH, or luteinizing hormone, rises, and this happens usually before ovulation, so it gives them a prediction when the likely time is that ovulation will occur. These tests aren't always perfect, and that's why I would always say to be a little bit liberal and try a bit before that too, so that you don't miss out on your chance of falling pregnant. Otherwise, it's really a matter of trying for a while to hopefully achieve a pregnancy. When should you seek help from a fertility specialist? Generally, we would recommend that after 6 months of trying, it would be good to seek medical help. In patients who have a history which is suggestive of infertility, this may be done earlier. So if the man, for example, had undescended testes, it would be good to do a sperm count earlier. If the woman has very irregular menstrual cycles, then that may be suggestive of not ovulating. It would be good to see a fertility specialist earlier. So these are the sort of criteria we use. If you would like to have a discussion about your individual circumstances, please reach out to one of us fertility specialists, and we'll be more than happy to talk to you and assess your case. With regard to lifestyle modification, this is really, really important. So preconception health is a really important part of improving your chance of falling pregnant and hopefully making the pregnancy and the baby healthier. So we recommend a healthy diet, which involves regular meals and healthy choices, and Look, that may vary from individual to individual, but generally that would be a good guide to have healthy choices in your diet. It's important to be relatively fit, so we would encourage you to exercise within reason and so that you feel fit and ready to fall pregnant. We recommend the use of folic acid, which is a vitamin that reduces your tube defects in the baby, and that's part of many multivitamins that are used in pregnancy. We'd also recommend not to smoke, because smoking is quite detrimental to short-term and long-term fertility, both for men and women. With alcohol, moderation is fine before you're trying to fall pregnant, but once you are pregnant, it's not recommended to continue to drink. With regard to caffeine, caffeine in moderation doesn't appear to affect female or male health, but again, moderation is the important word here. Otherwise, really, it's about becoming as healthy as you can in preparation for your pregnancy. Thanks for watching Fertile Minds, and don't forget to subscribe.